As Barbara mentioned, I'm Rachel Rowe and I'm one of the Active Leeds Development Officers, and I'm joined by my colleague Martin Lee, who's the Health Programmes Development Manager, who will be helping with some questions at the end. So we both work for Active Leeds, which is part of Leeds City Council. Leeds City is a very diverse city, and we have a citywide ambition to be the best city to be active in. And we were very excited to be involved in the We Are Undefeatable campaign, and it's been a really valuable opportunity for us to deliver the campaign locally here in Leeds. So this is the outline for our webinar today. So hopefully we will be able to talk you through a bit of a quick snapshot as to the approach that we took in Leeds and kind of the work that we've undertaken. And hopefully it will help to provoke some ideas and give you some takeaway thoughts around potential avenues for you to explore based upon what we've done and applying that within your own areas. So just to start with, I felt like it was helpful just to outline a little bit about the Leeds landscape. So Leeds is a thriving and ambitious city with a very diverse population. And as I mentioned before, we have an ambition to be the best city to be active in, and we want everybody to have the opportunity to live a more active life. But despite this, we face a huge challenge in relation to deprivation and the distribution of health inequalities across the city. So we currently have 16 communities in our city that are classified as being in the top 1% most deprived areas within the UK. And the health inequalities that are present also mirror this. And so much so that there's actually currently a 10-year age expectancy difference between the least and most deprived areas across the city. And then combined with those who are living with long-term health conditions, we have 54% of our population in Leeds who are living with one or more long-term health condition. So there's a growing priority to need to tackle these statistics and create a social movement regarding the importance of being physically active, especially when experiencing a long-term health condition. So the We Are Undefeatable campaign has consequently been hugely positive for us in terms of tackling some of these issues a little bit more locally. So in terms of the approach that we've taken, we wanted to be able to use the We Are Undefeatable campaign to enhance the personal care that's given by healthcare professionals and third sector organisations. We wanted to do this by giving confidence through workforce development and co-production to challenge people's perception that physical activity and the message of rest is best. So it was really valuable for us to be able to have the support of the national campaign to feed some of these messages a bit more locally to the target audience through some partners such as third sector organisations and primary care networks, local care partnerships, and working with organisations such as social prescribers. To do this, we wanted to be able to embed some of these health messages a little alongside physical activity a little bit more locally by co-producing some of the schemes with those with long-term health conditions, by developing an ambassador scheme and working to find solutions to barriers to physical activity. Alongside this, we also wanted to develop a workforce that understood the benefits of physical activity, and also to challenge the misconception that people living with health conditions cannot be physically active, or that it would potentially exacerbate their conditions by being so. So through this presentation, I'll talk a little bit more about how we did these things and some of the successes and the challenges that we've experienced along the way. So in terms of how, we identified that in order to embed the physical activity messages into some of these local communities in Leeds and reach those with long-term health conditions, it was really vital for us to work in partnership with professionals who have direct contact with these individuals. Therefore, a real strong element of our project was working to build relationships with organisations such as Linking Leeds, who are a social prescribing organisation across the city, and building positive relationships with local care partnerships in targeted areas across the city. So to do this, we attended various meetings with the PCNs and the local care partnerships in order to build positive working relationships and to start getting them thinking about physical activity in a new way and putting it a little bit more on their radar. So across Leeds, there's currently 15 primary care networks, and then subsequently the local care partnerships. So as there's quite a vast number of them, we initially decided to target certain areas of the city based around factors such as level of deprivation and the prevalence of long-term health conditions, and those who had particular priorities around targeting physical activity. So we felt like this was a good approach to take, as it allowed us to kind of identify those partners who potentially had higher levels of power and interest in relation to what we wanted to achieve with the We Are Undefeatable project. And this meant that we could obviously target our resource rather than initially spreading ourselves too thinly. So as part of our approach, we initially wanted to work with these partners to embed a collaborative care and support planning approach, so that when patients who were living with long-term health conditions were invited to a consultation with a healthcare professional, that motivational style interviewing approaches would be adopted, so that we'd identified that during these meetings or one-to-one appointments, it would be an ideal opportunity to broach the conversation around physical activity, but it could be brought up in a way of helping them manage their condition. However, as part of this, we'd uncovered that a lot of the healthcare professionals didn't necessarily know how to frame these conversations, which then led on to the development of our physical activity dial, which I'll talk a little bit more about in a moment. And then it also helped us to kind of utilise our marketing and communication in terms of being able to work with these partners to promote the We Are Undefeatable messages and the campaign on a more local level. So I just mentioned that we felt it was really important for us to be able to help and create a useful dial that could be used by some of these healthcare professionals when conducting some of their one-to-one health reviews or appointments. And we recognised that there was almost a need to challenge some of the misconceptions that people living with long-term health conditions can't be active, or that it would exacerbate their conditions. However, we understood that it could be really difficult for some healthcare professionals to have these conversations, or even have the complete knowledge and understanding of what the recommendations are or where to start in terms of signposting. So this led to the development of our dial. So we were able to kind of gather feedback from these healthcare professionals as to what would help them and what we should incorporate with the dial. So the idea with this dial is that it could be a physical tool that professionals would have with them and available at appointments to help support a conversation around somebody being more active. We wanted it to be quick and easy to use and be able to support the idea of moving medicine. As part of this, we felt like it was vital for it to be as interactive as possible. So the blue layer that you can see on the left sits on top of the multicoloured layer, and it spins round so that it's interactive. We felt that it was important to be able to include various information on different types of physical activity, so that people didn't necessarily think that they had to undertake traditional activities, which is why we've included elements such as gardening and daily living, just to help promote how you can actually go around and meet some of your recommendations by just living a more active life. So we really felt that this resource allowed us to help reframe some of the conversations and allow it to be more asset focused and concentrate on what a person can do rather than what they can't do. And we felt that when healthcare professionals were having conversations, this was a great tool to help that conversation. We also felt that it was important to try and include activities that related to the local communities that they were living in. So we tried to help by including information on what activities were in a local area, so that when participants took their dials away, they could be used as a prompt as to what information they might want to find out further, or just as a bit of an idea of what is actually out there. So this next slide just shows a kind of a picture of the back of the dial. So again, we felt like it was really important to try and include specific information relating to the We Are Undefeatable campaign and its key messages, as we felt this was the best way to embed some of the messaging on a more local level. We also wanted to include information about how people get started, as we'd recognise that despite people obviously attending these appointments, in terms of a behavioural change cycle, people aren't always necessarily ready to take action at that moment in time. Therefore, we'd recognise that it was important to include information as to how to contact people or get more support at a later date, which is why we included the specific contact details for active Leeds. And we also found it helpful to include a QR code that could be scanned at a later point in time. We also worked with the healthcare professionals to incorporate the dials as part of a referral process in which they could access their direct system of System 1 or MIS. They were able to directly refer into us if they'd identified that an individual was ready to begin their journey in terms of being more active and they needed more support. They could refer directly into one of our services. So in order to implement the dials, we recognised that there was perhaps a need to develop some training that would support the use of the dials, as we'd identified that if the dials were just to be given to healthcare professionals or third sector organisations, they wouldn't necessarily know how to use them correctly or how to frame the conversation. So we consulted with some of these partners to understand how best for us to deliver the training, and our initial plan was that we would develop an e-resource which would kind of be recorded and given to the healthcare professionals and wider partners to access at a later time. And it was identified that this would be a great supplement to existing training that they were currently undertaking. However, as we kind of developed throughout the project and we were obviously hit by COVID, it turned out for us that it was far easier in terms of resource and time, that it was more effective for us to deliver the training via online means such as Teams or using Zoom. So what we did instead of developing the resource was we ran separate sessions in which people could attend the training, and the sessions were then recorded and they were sent out at a later date to these professionals. Initially, again, we'd set out to work alongside colleagues within the Better Conversations training team who are part of the Leeds Community Healthcare, and we'd wanted to work with them as we felt like they had good skills and knowledge in terms of how to help people frame conversations, in terms of making every contact count and framing conversations. However, as COVID hit, the Better Conversations team, unfortunately, were set to other areas of the city and we were unable to work with them. So it meant that we were left to deliver the training ourselves. However, we tried to make the most of the situation and turn this into a positive, in a sense that we were still able to deliver the training and we were still able to get the messages out there. Again, one of the kind of positives was that we were able to deliver it. However, a negative of this was that with COVID, the partners that we were trying to engage with were those that were perhaps frontline workers. So it did cause a few problems in terms of them having the time to kind of dedicate to attending the training course, as obviously they had differential priorities, which made it a little bit more challenging when we were trying to engage with them. So in terms of the content of the training course, so the time frame was within 30 to 45 minutes, depending on time available and who we were delivering to. And the content of the course initially began around kind of explaining some of the messages around physical activity and understanding what the physical activity guidelines are. Then we brought in elements of the campaign and the key messages as to what we wanted to promote on a more local level and how these should be communicated to clients that they were dealing with. And then lastly, there was an element around how to use the dials and how to frame conversations and the benefits that we would hope to see from using them. So to date, we've currently trained up organisations such as Linking Leeds, various healthcare setting partners such as GPs across the city, and we've got ongoing plans to train up organisations such as 1U Leeds, wider rehabilitation partners such as cardiac rehabilitation. And I'll talk a little bit more further on about how we were planning to kind of capture some of the impact of the dials, as this has proved a little bit more challenging than perhaps we'd first expected. So a large part of the project within Leeds, we felt that it was important for us to be able to capture some robust and objective evaluation. So as a big organisation, we'd had previous experience of working with some of the universities such as Leeds Beckett and University of Leeds to capture monitoring and evaluation as part of previous projects. So as we'd created the dials, we felt like it was important for us to be able to demonstrate the impact of them and not just be able to say that we think they're great, but we wanted to have the evidence to support that as well. So we recruited the University of Leeds to come on board to undertake more of this evaluation, as we felt that they were better positioned to be able to capture it in an objective way without having bias. Therefore, we're working alongside them to be able to better understand some of the messages around physical activity and how we can best use the campaign to have consistent messaging across the city locally. And we also wanted to be able to examine if there'd been an increase in the number of healthcare professionals who were using the tools, and if they'd actually then been embedded into some of these one-to-one meetings that they were having with clients. So to do this, we plan to undertake focus groups and interviews to uncover kind of more insight about how the dials are being used in practice and their effectiveness. So this is something that's very much ongoing with our project at the moment. We're kind of not really there yet, and we've had a few setbacks with COVID. As I'd mentioned earlier, some of the partners that we had recruited initially have then gone on to have different priorities, with them being pulled in different directions regarding COVID vaccinations and flu vaccinations. So it's meant that they haven't necessarily had the time to be able to dedicate to us in terms of capturing some of the evaluation. So over the next few months, this is something that we hope to capture a little bit more, and we're working alongside the university closely to be able to pull together a cohort of participants who we can use for these focus groups, just to gather a little bit more insight. So I've spoken obviously about the dials and kind of the importance of them, but another key factor that shouldn't be underestimated within our project is the importance of the communication and branding. So as a local authority, we felt that it was really important for us to be able to have clear messaging, and initially we felt like this wasn't the case. So within our health programmes team, Active Leeds encompasses several projects of work across the city. However, we felt that the team really lacked an umbrella brand which we could use to bring all of our work together to be recognised. So this is where we developed the Active Leeds for Health branding. And we felt that it was important to include Active Leeds as part of this, as for wider service users, it would help them to recognise who we are in terms of our health and activity focus within Leeds City Council. So as part of our communications and branding push, we decided to recruit a graduate marketing assistant who would be able to lead on all of our comms and marketing for our project. We found that this was massively important to the project, as it meant that we had a key individual whose sole job was to develop resources, develop new ways of thinking in terms of getting the wider We Are Undefeatable messaging on a more local level, as we'd found that although previously we'd had the best intentions to have strong marketing and communications, within the development team that we work in, we're often pulled into more development focused kind of work and can't always dedicate the time to the communications and branding. So I think having that individual who was able to be solely responsible for it really helped to elevate what we were able to do locally and just helped create more consistent messaging. So as part of this, we updated the Active Leeds website to have a key feature of We Are Undefeatable. So we wanted to have a separate web page where people could access key information around what the campaign was and what we were doing locally to support that. So that involved us rewriting some of the information and reframing how we'd featured some of the content on our website. We also wanted to look at how we could support people to be more active at home, and this was crucially important throughout the last kind of 18 months to 2 years with the prevalence of COVID. We'd recognised that a lot of the people with long-term health conditions that we were looking to target and support would obviously be shielding at home or would perhaps not be able to be as active as they would previously have wanted to. So we developed resources that would encourage them to be more active through our Keeping Well at Home pages. And the next part of the communication and branding that's kind of been really important and integral to our project is the link with our wider central campaign, which is Love Yourself. So Love Yourself is our Active Leeds service campaign, and we really felt that the We Are Undefeatable branding and messaging really resonated with what we were trying to do within the Love Yourself campaign, as it's all about inspiring people to love themselves, no matter what their age, what their size is, or what their condition. It's all about doing something you enjoy and encouraging people to move more. So what we wanted to do was embed the We Are Undefeatable messaging as part of this. So we worked closely with some of our ambassadors to incorporate some of their stories into our central campaign, as we felt that it was important to have people who are a true representation of people with long-term health conditions embedded as part of this. So this brings me on to our ambassadors. So as I mentioned before, we developed an ambassador programme to support our marketing and comms, and we really wanted to be able to have people from our communities who were people like me that people could relate to. We wanted to use the idea of the We Are Undefeatable personas to have real life people from our city, and we were lucky enough to be able to recruit 4 ambassadors. And we utilised them to be able to share their stories around living with long-term health conditions and what they do to be more active and how it's helped them. So we had a range of individuals, even managing to recruit one of our councillors from across the city. So we felt like these were powerful individuals that would be able to act as role models within the community and people that they could look up to in terms of sharing their stories. Probably in an ideal world, we would have liked to be able to recruit more than 4 ambassadors. However, again, with the impact of COVID, it made it a little bit more difficult because we weren't able to perhaps have the reach to some of these individuals that we would have had previously, as they would have been shielding or not as active in communities as they would have been previously. So in that sense, I think we're really happy and positive about having these 4 key individuals who are out there spreading the messages of We Are Undefeatable. And we've actually noticed that they've been able to create kind of good links within the community, and their stories have really resonated with people. And part of our legacy will be that these ambassadors will still exist and they'll still be out there spreading the messages kind of post-project. And as things have developed more recently, we've actually been approached by other individuals who have wanted to come on board with our ambassadors scheme. And I even spoke to a lady just last week who has shared her cancer story with us and how physical activity helped her. So we're going to be recruiting her as one of our new ambassadors for the programme. So I've touched a little bit about some of the learning kind of that we've undertaken, but I just wanted to reiterate some of the key points in terms of the success and legacy for our project locally in Leeds. So for us, the creation of the dials has been a real success and something that's kind of been a real tangible outcome for us to be able to utilise within communities. We feel that the rollout of the training has obviously supplemented the use of the dials, and this will be something that we will continue to utilise. And going forward, we see this dials training featuring as part of our wider public health healthy living training. So it's something that we see still continuing kind of post project. Again, the use of the ambassador scheme, as I just mentioned, these are real life people who are kind of living their journeys and stories at present, and the way that we've managed to empower them, it has been a success in a sense of they're still really keen to kind of be out there spreading the messages, and we've been able to upskill them, enabling them to do so. And again, a real success and legacy is the way that we've been able to change the premise of conversation in terms of the way physical activity is prescribed. Previously, healthcare professionals may not necessarily have initially thought about using physical activity as a prevention or as a way of managing somebody's long-term health condition, whereas we feel that using the dials alongside this has helped change that conversation into a more positive mindset. However, this all being said, there's obviously been a lot of key challenges along the way with our project, and as I'm sure is the case in a lot of areas, COVID-19 has played a massive part in that. There was obviously times where we kind of had to reevaluate and change our way of thinking in terms of the training and the recruiting the ambassadors, and just generally things have taken a little bit more longer than we would have liked. So this again is not to be underestimated. Another key challenge has been in terms of the partner priorities. I touched on it a little bit previously around the key individuals that we wanted to engage were often those that were frontline workers. So it's sometimes been challenging to get that engagement from them. And although they've been very keen initially, when they've been pulled in different directions, it's meant that we haven't been able to get that continuity with that engagement. So that's obviously had a negative effect on the evaluation that we've been able to collect, but we are hoping to kind of turn that around and still be able to capture some meaningful evaluation, if perhaps it's not on the scale that we would have liked. And another key challenge that we've had to face is with the remobilisation. Obviously, as a result of COVID, things were very stop-start, and we've also had a lot of changes to our staffing within our team. So that's just meant sometimes there's not always been that consistency internally. So that's just slowed us down a little bit and made things a little bit more challenging. However, that being said, I think we've been really lucky to be able to have the project here on a local level in Leeds, and in terms of our next steps, we're really going to try and push forward in terms of getting those messages out in the community and ensuring that the conversations are still taking place. So a key priority is for us to continue with the research and evaluation in partnership with Leeds University, and we're hoping that that will be concluded within kind of spring 2022. So over the next few months, we're going to be working closely to look at co-producing a range of activities based upon need and what's needed locally. So we want to work alongside some of these peer support groups, such as cancer rehabilitation groups and various other ones, to look at what physical activity do they want in their community and how can we help embed those as a resource that they can access. Again, we want to continue with the use and rollout of the dials, and we want to be able to continue shaping conversations with various different organisations. So we'll actively look to work with a wider range of partners. And we've also recognised that there's potential to build on the existing shape of the dials. So, for example, there could be a need to look at doing specific citywide locations, or look at targeting certain audiences, such as specific long-term health conditions, or even certain demographics. We'll also plan to continue growing our ambassador programme. As I mentioned earlier, we're still having conversations with people about how they can be involved, and we think that's something that's going to continue kind of very much post-funding. So we will continue to have these key individuals out in the community. And then as part of that, again, we will continue to communicate and spread the wider messages of the We Are Undefeatable campaign on a local level here in Leeds. So that concludes our presentation. I hope you've enjoyed listening, and we'll now be happy to answer any questions that you might have. Thank you.
Thank you very much indeed, Rachel. That was really clear and engaging, and there's been quite a bit of interest in the chat about the dial in particular. So I wanted to start by asking, is there anything we can share about this? Is there a link to the actual dial itself or to the training at all? Because people are really interested to read more about it and see what it looks like.
We've got the training slides that we can share with everyone. That's not a problem. They're pretty much self-explanatory. With regarding the dials, we're happy to, if people want to send their postal addresses, we'll actually send them out, because actually having it in your hand is much more tactile and you understand it more than maybe on the screen, because again, it's on a couple of layers. So yeah, if any our email addresses are there. If you want a copy of the 2 dials that we've got, then just send it through and we'll post them through to you.
Perfect, thanks, Martin. And I just wondered, you talked a little bit, Rachel, about the evaluation that you're planning with the University of Leeds. Has there been any anecdotal feedback at all on how they're being used and what the response has been among the healthcare professionals at all?
From my point of view, we have been having conversations with different healthcare professional groups. Where it seems to have gained most traction, funnily enough, is the new PCN funded health and wellbeing coaches. So these health and wellbeing coaches have been funded across Leeds to support people with their behaviour change into physical activity, new diets, nutrition, and with regarding mental health as well. So certainly, with example of the announcement yesterday by NICE for mental health, again, people potentially coming to physical activity before being prescribed antidepressants. I got a couple of emails yesterday from directors asking to see what we could provide, and actually this particular dial was what I offered them. It's about the opportunities exist across the city. It's about trying to link up people that need support with some of those opportunities.
Mm. And was there any charge at all? Somebody's asked in the chat, was there any charge for the training or for the dials, or was that fully funded as part of the work?
All fully funded.
Yeah. Brilliant, really interested in, and thanks for sharing your contact details there on the last slide. So hopefully everyone can jot those email addresses down and get in touch if they'd like to receive a dial. I wondered if I could also just ask a little bit about the impact of COVID, particularly in terms of the relationships with the healthcare professionals, because this was obviously such a difficult time to engage with that sector, but you managed to have some successes there in getting the dials out there and people trained and getting them embedded. So I wondered if you could share any wisdom in terms of how you managed to do that in this quite tricky context.
The first thing for us was, and I suppose this is all about timing, is the 15 local care partnerships launched literally just before we went into the COVID pandemic. And it was very obvious to see, especially when shielding came in, that people needed to move more at home. And we were very proactive on our normal communications about things we'd put on YouTube or linking to, other sort of things, toolkits that people could use at home. So we could build on those conversations quite quickly. The problem that we faced initially was, obviously they were, healthcare professionals were all over the place, redeployed and everything. But as we sort of worked through, our initial bid was around to have some kind of training tool that people could then train themselves on. That was highly ambitious, and to be fair, we couldn't have delivered that. But then things like Zoom and Teams came more prominent, so that gave us the platform to be able to have conversations and training for people. And to be fair to Leeds City Council and our health colleagues, they invested a lot of money on us being trained up on how to deliver workshops and webinars and things. So this project's become a part of our sort of public health resource centre and some of the development that they get. The dial was something that came slightly later and came through conversations with healthcare professionals about wanting something tangible. I think there still is a barrier here because not everyone is being seen face-to-face in primary care or being seen face-to-face even with some of the hospital programmes and things at the moment. So they have asked for a digital wheel, which is probably beyond us at the moment and beyond our skill set. But certainly as people start to get back to the face-to-face groups, these have started to become more prominent and we've started to see more dials come out. Initial thoughts are we can adapt the dial for any situation. You can reframe the conversation for the individual target group, the individual area. We've had a response about putting the dial into Punjabi this week. So again, even different languages and stuff, and really sort of trying to, not have too many dials, but embed those key messages within individual groups across the city.
Yeah, brilliant. And another question has just come in from Laura in Active Surrey. How have you aligned the work with additional training? Has it led to increased uptake for other opportunities such as moving, is medicine, MECC, clinical champions training, any of that? Is there some alignment there?
Yes, there is. Funnily enough, that's how the initial conversation came about. Was I used to support the delivery of the physical activity champions training, and we really struggled to get staff to that training. So we wanted something that was a little bit quicker and easier to start the journey of the conversation around physical activity, so that it wasn't such a jump into moving medicine or into the Better Conversations team. People had, could take an hour out, be trained and have something that will constantly remind them of physical activity while they're having conversations with people. So having a little stack of these dials on the desk, constantly sort of reaffirms that physical activity should be a conversation starter for people.
Yeah, I think it's really interesting having something tangible, because that's a key thing, isn't it, with this, that isn't the case in a lot of other training. So you can't really forget it. it's there on the desk. The last question I just wondered if I could ask you is, looking back over the work you've done, is there anything you would do differently if you had another go?
Yes. And yeah, probably a global pandemic, I'd probably get rid of that. But the thing for me, I think we were far too ambitious to start with. Okay, I think we thought the whole city, we at that point, we had great contacts with all sorts of different healthcare professionals and third sector organisations. I would have looked at starting even smaller, okay, and brought our evaluation partner in much earlier. Now, that wasn't all down to us. We did have Leeds Beckett University that was our first partner, and they just, again, through COVID, didn't have the staff to be able to do the evaluation. And that's where we brought the University of Leeds in through recommendations and things. But I think if we'd have had those partners on probably 6 to 12 months earlier, okay, we'd have finished the evaluation now. I think we would have been a little bit further on. And just for us, I think we could have aligned better potentially with some of the COVID reset and recovery work. And this could have been a little bit more embedded in some of that work.
Got you. Thank you. That's really interesting. I think we'll wrap up, but that's been a really fantastic session. Thank you, Martin. Thank you, Rachel. And thanks to everyone for joining today. If you do have any other questions that you'd like to put to Rachel or Martin, or want to follow up in any other way, you're welcome to contact them. Their contact details are here, or myself, Barbara at insightangels.com, and we'll filter any questions in the right way. So hope you found that really useful. I know I found it very interesting. There are further sessions taking place with other areas over today and tomorrow. If you'd like to join any of those other sessions, while formal registration is now closed, you can still access meeting links directly. There's a link to all of those in the invite for all of the sessions. So in this session, you'll find a link to that. But any problems, just feel free to contact me. But thanks very much. Thanks to our wonderful presenters, and thanks to everyone for joining.